Hi, I am Dr. Raman Tanwar. I am the Secretary General of the Men's Health Society of India, and today we're going to talk about men's intimate health with Best for Him. So the Men's Health Society of India has actually studied some of the parameters why men are lagging behind when it comes to health. In fact, you'll be surprised to know that most men, they are dying earlier than their female counterparts, and on an average the lifespan of men is 3 to 5 years less than that of women. And the reason behind this is that men do not take stress the right way. They don't talk about their stresses. They basically keep it inside. They have a lot of family responsibility which slowly eats them away. Being the breadwinners of the family, they need to come, they need to discuss their problems so that the treatment can be started very early and before it goes into a stage where it's irreversible or chronic. Also, you have to understand that men abuse substances a lot. So most of the alcoholism, the amount of alcohol intake that men have compared to women is much more. The smoking population again mainly comprises of men. All the risk-taking behaviors like the fast riding, the road traffic accidents, and all the high-risk professions, they are basically taken care of by men. So somewhere, everywhere we have to use some sort of a safety, occupational safety, staying away from abuse, staying away from drugs. These are some of the things that men can do to again take care of their health. Lastly, I would like to say that men do need to come to the hospital because unlike women who go through menarche, through their periods and then through childbirth, and that way they get connected to the hospital, in men there are no such milestones where they have to definitely visit a hospital. So whenever there's a chance to go for a checkup, maybe your company is hiring and you want to kind of join a new company, it's always a good idea to ask the company if they're doing a health checkup, or to go to your HR and talk to them about regular health checkups for the employees. And that will be a very good way as an executive health checkup, or maybe before you get married, maybe you can take the help of a premarital health checkup. And these kind of checkups can become the milestones when men can get connected to the healthcare. I think over the ages, men are more concerned about their sexual health than anything else. In fact, what I have seen is that one organ which is most important for men, which is not the brain, which is not the heart, is actually the penis. And so we get a lot of questions, a lot of queries, and a lot of patients around the penis, which is erectile dysfunction. We get a lot of patients with premature ejaculation. We get a lot of patients who are concerned about their penile size. And also, so many of them are actually confused regarding masturbation. I think the reason why men are not able to talk about sex is because they always keep hiding about it. They don't see it with the outlook as a physician would see it, which is like any other disease. So for example, you talk about heart attacks so openly, it's considered such an emergency. But when you're getting a penile attack, you really don't know where to go to. You don't know whom to actually approach. In fact, we did a survey where we asked about 1,000 men whom they would like to go to in case they had a men's health problem. And most of them had no answer. So that is quite amazing. They don't know exactly where to go. A lady, if you ask her if she knows exactly where to go, if she has a problem related to the lady parts, she has an answer that she has to go to a gynecologist. But the man, he has no answer. So I think we need to see this in a new light. We need to understand the role of an andrologist or a men's health expert as the person whom every man can approach if they have a men's health problem. So a lot of patients, they feel that if they talk to their friends or their close family about their intimate problems, they will be laughed at. There will be probably a reason to make jokes about. And this is absolutely not the case. In fact, when you try and open up to another man, telling them about such situations, we have seen that the behavior of most men is of sympathy and empathy. And probably you may not find it surprising that the other person whom you're telling your problem to would also have such a concern, and he may be able to direct you to a men's health expert or an andrologist. Now, the other thing is that when they come to us, first and foremost, the first thing we do is to normalize this. We tell them that every body part is prone to diseases, just like your heart, just like your brain, any other organ, your kidneys. So similarly, you have to think of your genitals also as an organ. You have to think of the entire genitourinary system as an organ, and it is quite prone to have a disorder or a disease. So it's quite okay to come to a doctor talking about it. And then usually when the patients are in the center, they see there are a lot of people talking about it. There are a lot of people who've gone in gloomy and they've come out happy. And I think that's a big motivation for people to speak up. Similarly, we also try and let the patients open up. We make them friendly and comfortable at home. And usually this chamber is one place where I and the patient are sitting where they can talk about anything in life. So many times when patients come to us, they either are a prey to some sort of a miscommunication or a social fad, something which is untrue, something that their friends have talked about. For example, masturbation is one of the biggest queries where patients feel that they've over-masturbated, they are in a masturbation guilt. The other common problem that we typically see is problems with erection, which may arise from masturbation guilt, they may arise from a psychogenic cause, maybe a pressure to perform, maybe comparing themselves to an erotic superstar, which is sometimes very, very far from reality. Sometimes we also get patients who have problems with getting the right time. They come too soon, or maybe they don't come at all. And in those kind of situations, again, we relate these things to anxiety, to the stress level, to some sort of miscalculations, miscommunications, something that they have known or heard about. And most of the patients are also concerned about penile size, which comes as again a comparison to what they see and what they hear. So it's quite funny, what we hear in our clinics. Typically, patients would come and say that, they are too thin because of masturbation, or they feel that, they've been behind class, behind studies because of masturbation, or they feel that, if they masturbate, probably they're more prone to weakness, illness. They will have infertility if they masturbate, or they may have erectile dysfunction if they masturbate, or their timing and all is all a result of their over masturbation. And this is typically what we call as masturbation guilt, which means that patients feel that they've done something wrong because our scriptures have said that, because our society has said that, because nobody has talked about it with them, and they haven't been able to discuss it with any of their colleagues. And that's when, they start creating a story in their mind that, the brain always tries to think about a causative factor to a disease. For example, if you have pain in your arm, you will try to relate it to maybe you had a trauma, maybe you worked too much, maybe you wrote too much. And in fact, it may be a separate disease. So the propensity of the mind actually is to think about some cause as to why these things are happening. And whenever anything abnormal happens, which is unexplainable, then those people are going to relate it to over masturbation, which is actually they've been masturbating just the right amount, probably, which was required for their sexual appetite. But that's how the mind has taken it to, and it has made masturbation the main culprit here. So typically what most of the studies say is that the sexual pleasure has no relation to the size or the length of the penis. There has been some correlation with the girth of the penis, but to satisfy your partner, you should really know about certain special things, like how to basically excite the partner and what are the various erotic touches that the partner wants to experience. And then talking about sensate focus, finding those areas where your partner, when you touch them or when you simulate them, they are more likely to get stimulated and to enjoy the entire activity. That's what really counts for the pleasure, not the size of the tool. So this is something that every man should know, that the ability to think about the other partner first in a sexual relationship is something which is more important than to think of themselves and to be done with their job and then forget about their partner. That's one of the reasons of a bad sexual experience. The other thing we want to tell each and every man is that size typically is not as big as we see typically in those movies. That size may vary anywhere from 4 inches to about 5.5 inches. And also the way to measure it has to be correct. So what we measure is a stretched penile length, where we take the entire length of a stretched penis from the bone, which is called the pubic bone. And many men who are, in this modern world, fat and a little overweight, where the prepubic fat is also too much, there you won't be able to see the penis as quite satisfactory when you look at it just like that, unless you compress on that fat and unless the man is excited or unless the penis has been stretched. So don't make an image of your penis and think that you're really negative down there. Really consult somebody and read about it and try and find out the truth rather than just thinking about it and getting worried without reasons. As much as 95% of the time, the kind of young men we get in our clinics, they don't need any specific treatment. They just need to be counseled that they are doing it right. They don't have to think too much about what will happen if it doesn't happen, what will the relationship be like in case it doesn't happen. They have to just focus on the fantasy, how they want to do it, how they want to imagine their partner, and the kind of bonding that the two people have together. If they focus on the right fantasy, typically the anxiety level reduces significantly, and then most men will be able to perform well. Only to help, sometimes we may get a evaluation of the general health of the patient and then maybe prescribe a few nutraceuticals or maybe a few pills that can help them overcome that initial anxiety phase and get on with their relationships. In patients who are not responding to these medicines, where we do see there's some sort of an organic cause, we try to figure out that cause by a few tests, by a complete detailed history and evaluation, and typically we focus on the treatment of that particular cause, and that typically makes a huge difference. Only say about 1% of those patients who have presented with erectile dysfunction may need some sort of a further treatment, maybe long-term pills, maybe some sort of injection therapy, maybe some sort of a surgery in the end that we typically call a penile implant or a penile prosthesis insertion. Sexually transmitted disorders are one of the biggest challenges that still persist in today's world, and the answer is quite simple, which is to use protection every time that they engage into intimacy. But the thing is that many people will feel that when they use a protection, the kind of excitement that they have, or the entire process where they have to use the protection in the middle of the act, it kind of mars the excitement. But then they have to understand that this is an important part, not just for them but also for their partner, because we never know who has what just by looking at them. And typically, in case the partner has an infection and you catch it, the way you can figure out is if you have any rashes, if you have any discharge through the urine pipe, if you have severe burning when you're passing urine, if you have problems in the foreskin and you're not able to retract it, or if you find there are some ulcers or any lesions in your groin in the form of any swellings. So these are the common STDs that present to us, and these are the presentations, and typically you just need to visit andrologist or a urologist or even the dermatologist. They also look into the STDs very commonly, and they would just prescribe a few tests and give you a few medicines, and most of these STDs you are able to get over them quite easily with just 5 to 10 days of therapy. So typically in health checkups, what we do is we examine you, in the sense we check your pulse, BP, we ask you for any symptoms, we get a battery of tests including the health of your heart, your lungs. We also ask you about sexual concerns if there are any, because sexual concerns also, when we look at it, they are not just sexual problems, they are actually the harbingers of anything big which may be coming your way. So we have seen that most men who have erectile dysfunction or who have some sort of a sexual dysfunction or who have low testosterone, those men are more prone to heart attacks, they're more prone to diabetes, they're more prone to anxiety, to suicide and mental health illnesses. So all these symptoms, you can't ignore them. And in these health checkups, we try to bring those out and bring them onto the surface and do something about them. In the premarital health checkup, we allay the anxiety of a man when he's entering into marriage and he's not sure about how well he'll be able to perform or whether he'll be able to father a child or not. And therefore, we examine the patient, we go for some testosterone evaluation, we go from some semen examination, and then we kind of allay the fear that men have and make them more confident. So I think at every opportunity where man can go for a checkup, they should take that opportunity and get in touch with healthcare. So basically, our panel of experts at the Men's Health Society of India believes that men need to, 1, undergo screening at regular intervals. Secondly, they need to do some basic things to stay in shape. One is they should know about their genes, what problems their father had, what problem their mother had, and then go in for the specific screening of those diseases. They should be more casual about their occupation, in the sense that they have to make sure that they are safe first and they are stress-free first, and later they are going to be the breadwinners of the family. So we do understand the pressure that men have, but men also need to understand how much realistic pressure their bodies can take, their minds can take. They shouldn't feel overwhelmed, and then they should have a good set of people whom they can go to. They should have a few doctors that they can go to, a few clinics in their mind where, in case they have a mental health problem, in case they have a sexual health problem, or any other problem that they have, they shouldn't be ignoring it. They should have those numbers so that they don't have to figure out where to go, what to do, and that laziness of trying to figure out is actually what causes the delay. So if they are already in touch with the health system, they can go and approach early and get the timely treatment. Apart from that, I would like to say that exercises, staying away from all the abusive substances, and a healthy relationship with your partner, these are some very important things that men can look into to stay healthy and fitter. For more such amazing videos on men, log on to bestforhim.com or follow Best for Him.